Okay, so how many pregnant women do you know that had super frustratingly long labor processes? You know anybody?
Yes.
Yes. So what about how many women who actually the delivery process didn't go exactly the way they wanted? Maybe the baby was stuck in a transverse position, or maybe the head was up, so it was breech. There's so many women out there dealing with that. What about low back pain? How many people have suffered with low back pain during pregnancy, right? And so this is really important to know that you've got to make sure you get your spine checked during your pregnancy and also get your spine in alignment during pregnancy. Yes?
Yes.
And in addition, I want to show you some of the reasons why. So we're going to show on Erin, turn this way. This bone right here, we call this bone the sacrum. It's actually a triangular bone. It's right in your back. And this bone right here is really important because it directly interferes with your ability to be able to have a proper delivery and actually a shortened labor process, and for the baby actually to get in the proper natural position. And so anytime this bone gets out of alignment, what can happen is it can create what we call in utero constraint. And in utero constraint means the baby's in there not able to move around freely, so it causes the baby to get stuck sometimes in these positions that we talked about, the unnatural ones where they're transverse or their head is stuck up, their bottom is down, breech position. And so what we want to do is make sure that every pregnant woman actually has this bone in proper alignment. Again, making sure your spine is checked by a chiropractor and making sure that it stays in proper alignment during the entire pregnancy. What we're going to do is we're going to demonstrate how this adjustment can be evaluated, the spine can be evaluated, how the adjustment is performed, and how gentle it is. So we're going to do that on Erin actually right now. Come on over here. The awesome part about this is most women really love to lay face down. This is the only time they get to lay face down on the table. Are you comfortable right there?
Yes,
okay, good.
ma'am.
So what we're going to do is we're going to check right here the sacrum by evaluating the legs. And so what we'll do is we'll come up this way and we're going to evaluate and see if there's any constraint on there. Maybe one leg actually pushes easier than the other one. And so on this one you can see this side doesn't go as far. And so what we're going to do is we're going to do a gentle adjustment to the sacrum, and we're going to go ahead and lift the table, lift the drop up right here, and we're going to contact the sacrum right here with the hand and do a really gentle adjustment. And when we do that, we're going to go back and recheck the legs, and we can show you how it actually aligns back up again. And it releases the constraint on the uterus and on the baby. Okay, so we're going to come right in here. Okay. Okay, so what we're going to do is we're going to come back up here and we're going to check the legs, okay? And we want to look to see if those legs will move and they're even, okay? So you can see how beautifully they move there. Now what we're going to do is we're going to do the second part of this adjustment, and that's where we actually work on the round ligament. We're going to have Erin back up off the table. And you can lay on your back now. And you can feel the round ligament in there. You can kind of feel the constraint in there a little. Sometimes you can feel a little knob on there, just kind of a little button. And you just get in there and you apply a little bit of pressure on that round ligament right there. And it's really just about 30 seconds, maybe to about a minute. You can kind of feel it relax. And that's really it. Gentle, very gentle adjustment. So again, really important. This is going to actually help increase your odds of having a much shorter labor process, and as well as making sure the baby gets the proper alignment. So the delivery process can go really natural, exactly the way that you want to. In addition, like we said earlier, if the baby is in constraint, so the baby is not in the proper position, we can actually, a lot of times right after we do the adjustment, we can feel the baby turn, and many times I've actually felt baby get right in the head down position when they were actually in a transverse position or maybe breech. So if the baby's in constraint, that can actually create a lot of problems where when the baby is delivered, the baby is having colic issues, Maybe the baby doesn't nurse properly or latching on properly. So there's a lot of health related issues. So not only is it really important that during the pregnancy process that you get your spine checked by a chiropractor, that you actually keep it in alignment, and then as soon as the delivery process takes place, that you get that baby checked right away. So this is Erb Family Wellness. I'm Dr. Kimberly Erb, and we'll talk to you soon.